This short presentation looks at the essay for the module Exploring Patient-Centred Care. It's a reflective assessment and it's worth 50% of your overall module mark, and you don't have that much time before it's due in. You've probably had some experience of reflective writing, but this one's actually about nursing, so hopefully it'll be a great way for you to link what you've learnt in theory with what you're seeing in practice. So where to begin? Well, I'd probably start by making sure you knew exactly what was being asked of you. So go through the module handbook and look over the assessment guidelines. You also need to have a think about where you're going to get hold of information. You'll be researching the topic on which you decide to reflect, be that wound care, resuscitation. So where will you find the journal articles, the best practice guidance? And you also need to be really strategic and planned. You've got to think about the structure of the essay, but you've also got to think about how you're going to organise your time. There's absolutely loads going on at the moment with placement and lots of other learning. So when will you work on this essay? It's really important that you know what the markers are looking for, and that's why it's worth spending time reading through the marking matrices. These are what the markers use when they're actually assessing your work. It tells you what's a pass, what's a good, what's an excellent, and also where you pick up your points. So for example, 30% of your marks will come from application to practice. It's probably worth at the proofreading stage turning back to this marking matrices and thinking, well, have I demonstrated clear links between the content areas? Have I provided relevant content? Have I referenced a range of literature, for example? So the assessment itself is a 1,000 word reflective summary using Gibbs's model. You're to choose one of 5 topics that you're covering during the module, and you're to use literature to support your analysis, conclusion and action planning stages of Gibbs's model, and you're to include a full reference list at the end. So you can see just from the assessment guidelines how much they're urging you to think about your reflection within the context of the literature. It isn't just about you describing what happened to you or your feelings or your own personal development. You need to locate your experiences in the research, in the policy, in the theory. So think carefully about the topic that you choose. What can you discuss? What are you quite happy to describe your feelings about? And most importantly, what can you relate to the literature? And I think what's helpful in that is trying to get a grip of what reflection's for. It's about understanding things in their wider context, so understanding what's happened to you and how that feeds into nursing and what we know in general. Once you've chosen your topic, you'll need to go away and do reading on it. So read further, read about reflection itself. And then before you write, I would really recommend that you devise a very detailed plan so that you know exactly what you want to say in each part of the model. That makes sure that you do the complete cycle, that you include everything that you want to say, and that you put in plenty of references and wider literature. And finally, leave lots of time for proofreading and redrafting. You know at this point how important referencing is and how seriously the school takes it. And you probably also know that it takes 2, 3 times, 4 times as long to finish your reference list as you'd thought. So leave twice as long, leave plenty of space to get it finished. We're here over the summer in the Learning Development Centre, so if you do have any issues, if you want to discuss the essay with anybody, then please do get in touch with us. And you can contact me as the key contact for nursing. So good luck with the assessment.